I guess the question is, why do you get a Prexion? What's the impetus to spend that kind of money to get that kind of technology in the office? And so when you looked at these images, it was like, wow, they're even better. I felt like I was walking around inside these patients' heads. So I started researching who's got the best image, who's got the best software. And what I fell into was Prexion. The image quality you get is absolutely amazing. And if you're used to using 2D x-rays, which everybody does, periapicals or panoramics, you just kind of open a door to a whole new world. Because being able to see in any slice, any dimension, any direction opens up those things that get hidden when things are compressed onto a flat piece of film. And so from that standpoint alone, being able to diagnose and treatment plan has made a huge difference to every doctor here, including me, as well as hygiene, and it also gets the patient involved. Patient walks into the room, sees their face on the 3D part, they're like, wow, that's me. And you start taking away the layers, get down to the bone, get down to the teeth. They want to know what that hole in the bone is. Well, that's the abscess. Well, before that, it was like, well, doc, it doesn't hurt. Why do you want to fix it? They see that hole in the bone. They find out why it's there. It's boom. They want it done yesterday. And so from the standpoint of involving your patients in the treatment planning process, you can't do it without 3D x-rays. Prexion has a 12-year history in software. They're actually a spinoff from TerraRecon, a medical imaging company out in California. And so for the last 12 years, they've been in hospitals around the world developing the same software, the same hardware. It's not a dumbed-down, watered-down version for doctors or dentists. It's the same thing they use in ERs, GE multiplanar scanners, Hitachis, whatever units out there. So it's a wonderful bit of software. It's great hardware. It's instant gratification, because when you move the mouse, you move through the scan, you move through the database, and what you see is what you get. I think that's another thing that separates Prexion from a lot of other companies. Is a lot of times you have to draw a line, parameters. I want to slice this thick, this wide. You draw your line on the scan. The little hourglass shows up on the computer screen, and then you sit there and watch the dust particles fly around your room while you're waiting for it. With Prexion, as fast as you can move the mouse, the images change. So you have instant access to any information, and it makes your diagnosis more complete. It's like virtual surgery. You've already done the work before you've touched the patient, and the patient can see that, and the patient gets excited about what's going on in their mouth.
When I'm doing a root canal, a quick scan can show me exactly how many canals there are, what shape and size they are, their location, if there's any calcification. I can also see any periapical pathology that's present. Also from an orthodontic standpoint, it's been invaluable to me. If I have a patient who has an impacted tooth, within a matter of minutes, I can have a scan that gives me a 3D image of the tooth. I can see exactly where it's positioned, which makes the oral surgeon's job much easier. They know exactly where to go to find the tooth when they expose it. And it's also great for me because I know right where the tooth is lying, what its position is, so I know which direction to apply force to bring the tooth into the arch. It's a wonderful resource, and it really does take the guesswork out of dentistry for me.
Getting the Prexion in our office has changed things significantly. I guess, to put it simply, to me, the difference between having the Prexion and not having a Prexion is like having one eye or two eyes. If you think about doing anything in life with one eye, you can only see things in 2 dimensions, and that's all we had in dentistry for a long time. But now with the Prexion, you have the ability to see things 3-dimensionally, like we take for granted everything we see with 2 eyes or in 3 dimensions. And it just gives you so many advantages. I do mostly surgery, so for me, for implants, I can tell where the nerve is and how close I can get, whether it's buccal, lingual, all these kind of things. If I have impacted wisdom teeth, I can see where the roots are, how close they are to the nerve. If I think there might be sinus involvement from an infection, I can see if there's something in the sinus, soft tissue-wise, which we couldn't do with traditional x-rays in the past. So it's just made not only life easier, but it makes diagnosing things more accurate. It's also a tremendous boon for patient education and also getting a patient to understand what you're doing and agree to do it, because when you can see what the problem is, it's just so much easier.
The Prexion for me has been something that I have been dreaming of, sort of, for years, the possibilities of what could exist if we had something that we could look at a case in 3 dimensions. This has been the case with the Prexion. It's been fantastic. We've been able to look at cases where, for example, fractured roots, trying to find where a supernumerary tooth might be in relation to other things, so that we can figure out orthodontically where we need to move things, what we need to do as far as extractions. There's so many different applications, of course, implant placement and that sort of thing. So I've been very impressed with it. The total overall view that you get of it with the 3 dimensions, I think, are just irreplaceable. There's nothing that you could possibly equate with it. The Panorex is okay. It does a good job. I mean, you're able to see things that you wouldn't with a regular PA, but this just goes way beyond that, and it's like looking at the skull. You have it in your hands. So I've been very impressed with the Prexion, and I highly recommend it to anybody who is looking for a better understanding of what they're working with. So.